All right. In the interest of time, we'll go ahead and get started. So as I said, my name is Stephanie Ramirez. I am an outpatient speech language pathologist here at North Kansas City Hospital. And today I will be talking with you about cognitive changes and brain fog after COVID-19. So for today's plan, we're going to start off by talking about how COVID-19 can affect the brain. What we know so far, a lot of our knowledge and information is ongoing, so we're learning more as time goes on. We're going to talk about short-term challenges as it relates We'll leave time at the end for some question and answer. So if anyone does have questions, please wait until the end and we will talk about them then. So how does COVID-19 affect the brain? So COVID-19 can lead to an activation of the immune system that persists for months. And this has the ability to affect neural connections in the brain. We kind of see the brain in this fight mode, which activates when there is an immune response and inflammation. We also see increases in rates of stroke, hypoxic injury, whether someone has to go on the vent or doesn't have enough oxygen because of COVID-19 and difficulty with breathing. That can certainly affect the brain. Olfactory cells in the brain. So one of the first symptoms of COVID-19 is loss of smell, and olfactory cells are concentrated in the nose, leading to the olfactory bulb in the brain, which is actually very close to the hippocampus, which is involved with memory. So we're going to talk a little bit more about that and the anatomy of that as well. Long-term stress on the brain, the part of our brain that helps process through threatening situations, such as going through the disease process, worrying about finances and work, family, that's all happening in the amygdala, and that can actually appear larger in people who are chronically stressed. And then the areas of the brain that are involved in rational thought, planning, can actually get smaller because the brain is sending more information to those, fight or flight parts of the brain. And then some treatment side effects of COVID-19, such as sedation, intubation, various medications, certainly have the potential to affect our brain as well. So COVID-19 actually can affect our brain function in lots of different ways. And once again, thinking about the anatomy of the brain, you can see the olfactory bulb is right there in the front, very close to the hippocampus and the amygdala. So amygdala, again, important for processing kind of that fight or flight, and the hippocampus for memory. So once the, virus kind of enters the brain, it has very little area to cover before reaching those parts of the brain. And while there's no diagnostic test for brain fog, we can't do a CT scan, it won't be visible on brain imaging, patients and doctors will most likely rely on symptoms to have that diagnosis. And how prevalent is that diagnosis? It's actually more common than you might think. Greater than 40% of patients with COVID showed brain symptoms at the outset. So confusion, difficulty with memory, difficulty with focus, those types of things. And 20% of COVID-19 patients still report cognitive changes even after they've recovered from the initial symptoms of COVID-19. Early studies don't show correlation between severity of disease and brain fog. So you don't have to have a very severe case of the disease or hospitalization to have these symptoms. However, age, such as people over 70, did show an increase in risk for stroke and dementia following COVID-19. And I can say as a professional, I have I have seen several patients for this condition in my office already, and they were quite young, and we, were working on getting them back to work, and those brain fog symptoms were still bothering them even after their disease had improved. So the symptoms of long haul COVID patients for neurologic effects, you can see that brain fog is second only to fatigue. So it's quite prevalent. 80% of patients reported that. So when we think about short-term challenges for brain fog, people who are actively going through COVID-19 might experience things like headaches, dizziness, fatigue, difficulty with attention, memory loss, poor executive function, and changes in their mood. I think all of these things absolutely have the potential to impact quality of life, ability to care for family, ability to go to work. So as a speech pathologist, we work with patients to help work through some of these short-term challenges as well as some of the long-term concerns. So other concerns in dealing with COVID-19, we think about isolation. Social interaction is very important for brain health. We think about work and the demands of work, the work schedule, and maybe even, the responsibilities that the person has. Managing medications properly, managing finances properly if you are experiencing brain fog. Some people report that they have difficulty sustaining their attention to read, and some people even report difficulty with carrying on conversations with friends or family just because of that mental fatigue, the difficulty with maintaining concentration during those tasks. So thinking about what might be impacting you most right now if you are experiencing long COVID or some brain fog, and we will get to some of the ways to help with those things here in a little bit. Now, moving in from the acute stage to more of the long-term concerns, there is something called multi-system inflammatory syndrome that we worry about, that can lead to neurological changes such as strokes, seizures, Alzheimer's disease, Parkinson's disease. We don't know how COVID-19 will affect people over time, but people are doing lots of research to determine if these conditions are going to be exacerbated by having a long COVID. Also, long-term concern for the psychological impacts of COVID-19. So you might have PTSD, post-traumatic stress disorder. You might have depression, you might have anxiety, and all of those things, certainly if they're left untreated, can impact our ability to think clearly. So with all of that being said, I think it's very important to remember that help is out there. You are not alone. As indicated earlier, a lot of people are experiencing these changes in their cognition. It's very important to follow up with your doctor regularly. They can help monitor you. There are lots of research studies going on, as I said earlier, so you can sign up for a research study if you feel like that would be something that you would feel fulfilled by and help advance kind of the knowledge that we're gaining about the brain and COVID-19. There are a lot of support groups out there, both in person and online. So there are, I have a few written down. We had, let's see. There was the Long COVID Alliance, and actually I'll talk about this in a little bit, but it's a network of patient advocates. There's also Survivor Corps, which is a grassroots movement connecting people with long haul COVID. And I found several Facebook groups, one being Healing Hope KC, and then the hospital, North Kansas City Hospital, is obviously trying to reach out to people by offering these education opportunities. There are specialty clinics in the area, pulmonology, speech therapy, occupational therapy, physical therapy, all of those things that can help with some of these symptoms. And I think being proactive is probably the best advice that I have for you. So if you're currently dealing with this, try, not to kind of take a wait and see approach, but be proactive in trying to exercise your brain. Although it is not a muscle, it functions very similarly to a muscle, in that you can train it and make it stronger and sharper. So in the recovery of COVID-19, therapy can be a very useful tool. So as a speech therapist, I have a role in the recovery of patients that have experienced brain fog as a result of COVID-19. And a lot of people kind of wonder, well, what does speech therapy have to do with my brain? And what I say to that is that my role is really everything from the neck up. So when we think about cognitive functioning, swallowing, breathing, voice, all of that is in the speech therapist's realm. So as far as my role, I work with patients to do an evaluation, see what areas we need to address. And then we come up with a treatment plan together. And usually treatment is kind of two pathways. One, we have restorative intervention, which is, again, as I mentioned earlier, exercising your brain, kind of building back those neural pathways and helping with different strategies for memory to make things easier for you. And then the other pathway is adaptive. So compensations, things that we can change in your environment and in your life that will just make things easier for you. We also work a lot on symptom management. So as I said, a lot of people complain of headaches and fatigue. So we really focus in on how we can help with those symptoms and how we can minimize them. Learning about triggers and different strategies like that. And then we also work very closely with other disciplines, other professionals to help provide referrals for other therapy if that's needed, support, and then education so that people can understand their condition a little bit better. And so as a speech pathologist, I thought I would leave you with some exercises and strategies that can help hopefully right now if you are experiencing brain fog as a result of long haul COVID. So some strategies for memory. First and foremost, writing things down is very, very important. If it's written down, you're not going to have to spend valuable brain energy remembering it. Also, it can help keep you organized. So I always recommend having a planner or a calendar that you can use. A wall calendar can be helpful if you have a family. A planner, something you can carry with you, can also be helpful. And don't underestimate the value of good Post-it notes and notepads in strategic locations throughout the house. Those can absolutely be beneficial. When you have a thought, you can write it down and then you're much less likely to forget. You could also have a person or a device help you. So if you have somebody living with you, you can ask them for assistance. You can also use your voice recorder option on your cell phone. You can use timers, alarm clocks, Alexa and Siri on the phone can also be handy because you can just talk to it and tell it to help you remember something or do something at a specific time. Following a routine is also very helpful for your memory. So trying to do the same thing on the same day, you're much less likely to forget to do it because it is something that you are kind of ingrained to do. So always putting things in the same location so you're less likely to lose them, staying organized in your home, keeping a to-do list of things that you need to do for the day, and following that list so that you can stay on track. And finally, as far as your memory goes, there are a lot of other factors that can affect your memory, such as sleep, pain, and time of day as well can be very important. So, if you're a morning person, you probably want to think about doing your most cognitively demanding tasks in the morning. If you're not a morning person, morning is probably not the time to balance your checkbook or manage your medications because you're more likely to make a mistake. So thinking about those factors that can boost your memory and just put you at the best possible position to be successful. And now earlier I mentioned how stress can affect your brain function. So I think managing stress and the symptoms of COVID-19 is absolutely important um, when we're thinking about, working with brain fog and functioning at your best. So let me just move here. So when we're thinking about managing stress, we really want to think about pacing yourself, taking lots of rest breaks throughout the day. You might even use a timer to remind you to take a rest break. Again, fatigue was the first symptom, the top symptom that people reported before brain fog. So really managing that fatigue. If you try to go too fast through things, you're more likely to make a mistake and you're more likely to feel stressed out. If you are feeling depressed or anxious, don't ignore those feelings because it will impact your brain function and it probably will make that even worse. So talking to your doctor about that, getting treatment, whether it is, seeing a therapist, there's lots of virtual options now as well as in-person options. And there's also medication that can help if it's needed. So definitely something to talk to your doctor about. Planning ahead when you know that you're going to have a lot to do and maybe delegating tasks to someone else or moving them to another day to keep you from getting overwhelmed or overscheduled. And again, that's where writing things down and using a schedule can help you because you can actually visualize what you have coming up. And then finally, using some relaxation techniques such as deep belly breathing, progressive muscle relaxation, some meditation strategies can help to clear your mind. I've had a lot of patients who have tried the Calm app, CALM. It does have some free content on there, so you can see if you like it, but it's got some different meditations, music, different breathing exercises, even some stories to help you fall asleep. So they have a lot of different apps out there. That one specifically is the one that I have experience with, but you might check those out as well. And then when it comes to your brain, I can't stress enough the importance of self-care. A lot of times we're so busy taking care of other people that it's difficult to take care of ourselves. So especially when you're recovering from COVID-19, it's very important to get good nutrition so your body has the energy and your brain has the fuel it needs to recover. It's very important not to skimp on sleep. We should aim for about 8 hours per night. A lot of people cut down on time, sleeping because they want to get more done during the day. But actually, when you get less sleep, your energy, your mood, your productivity all suffer. So actually getting more sleep can help your brain function well. And then physical exercise should be a goal of about 30 minutes, 5 days a week. It doesn't have to be anything super, super strenuous, just a nice walk outside. The weather has actually been beautiful here lately, so we should take advantage of that while we can. Exercise helps boost your energy levels. It helps fight fatigue. And there are lots of research articles out there showing the connection between physical exercise, heart health, and brain health. So really thinking about anything that's good for your heart is going to be good for your brain. So going back to the eating as well, thinking about, lots of fruits and vegetables, lean protein, fish, nuts, olive oil, and really avoiding those things like sugar and caffeine that are going to give us a quick boost of energy, but then crash later. And so, as I said earlier, I think it's very important to know that there are lots of resources out there if you are experiencing brain fog. The North Kansas City Hospital has physical occupational speech therapy to help with all of those symptoms that you might be experiencing, brain fog, fatigue. And then obviously, as you're watching this, educational opportunities as well. And we do plan on continuing these education sessions and providing that support to the community as we learn more about this condition and as we can help that community that is still struggling with long haul COVID. As I said earlier, I did find a Facebook group. There it is written down there for you. Healing Hope KC is a support group for those dealing with COVID within the Kansas City area. There's also some national groups as well on there, so you might find something. The Long COVID Alliance, again, is something that you can join in. They have lots of resources, education, and their goal is to help advance research and have a better understanding of post-viral illness. Survivor Group, or Survivor Corps, excuse me, is again that grassroots movement that is supporting, educating, mobilizing COVID-19 survivors. And again, it's helping to advance scientific and academic research. So all of these things, and I'm sure that as time goes on, there'll be even more resources out there for people. So definitely check back and see what's new in the Kansas City area, as well as what's new nationally, because there is a lot out there. You're not alone, and there's definitely resources available to you. So in kind of talking about those grassroots movements and those organizations, there are a lot of new research endeavors starting. This one is one that's actually going to be funded by the Alzheimer's Association, but it's going to involve over 30 countries, and they're going to specifically look at the neurological effects of the coronavirus. So definitely keep an eye out on news and reporting from that research. I think that, you know, a lot of times we feel like we're alone in some of this. A lot of my patients have said that, you know, they look the same, but they just don't feel the same. And that's been the most frustrating part. So just realizing that you're not alone. There's a lot of people out there that are dealing with this, and there are a lot of people out there working to understand this better. So with that being said, I kind of wanted to finish today with a positive note that, you know, it is very important to be proactive. As I said earlier, exercise your brain, keep it sharp. You know yourself best. So if something's not right, even if you look the same, everybody says, well, you look the same, or you still, can do the same things that you did before, but you know yourself best. So if something's not right, talking to your doctor. I think it's important to focus on the things you can control, such as, using some of those memory strategies and, seeing your doctor, seeing a therapist, and really celebrating those small victories. So as you, feel like you are kind of gaining back a little bit of what you might have lost through the COVID-19 pandemic, it's important to celebrate those small victories and really try to stay positive and see that you are moving in the right direction. And some of those little graphics down at the bottom, I liked the last one there. It's, you're not broken, you are breaking through. So hopefully everyone feels like they can leave today with some ideas for how to break through some of these brain fog complaints that can often accompany long haul COVID. And with that being said, I'll open up if anybody has any questions. Otherwise, you can feel free to contact me. I will put my phone number and email up there. If you are interested in doing speech therapy or any other therapy, it's typically covered with a doctor's order, and that can come from primary care doctor or any other doctor that is on your team. So if you want information about how to be part of therapy, we would be happy to help you with that as well.
All right, thank you, Stephanie. That was very, very interesting. I am very thankful that you laid out some of those, because I think sometimes it's just good to have a reminder of certain things. Like, hey, when you eat healthy, it actually helps your brain.
Absolutely, yep.
Okay. Well, I'm not seeing any questions, but if anybody has them, we're going to hang on for just a little bit longer. And you can also go ahead and email Stephanie your questions if you think of them afterwards. So this will be posted to YouTube as well, so you can watch it again and share it. All right, Stephanie, it looks like we're good.
All right. Thank you so much.
All right, thank you.